Good morning, everybody. Thank you for being here on this beautiful morning. First off, want to thank you for your patience. We had some technical difficulties. It happens sometimes, but thank you for waiting. My name is Henry Liu. I'm here on behalf of Hoag Hospital, and we're excited to present to you our webinar on Hoag Medicare Benefits, on some of the overviews of the health plans, and I'm here to start out telling you a little bit about Hoag Hospital. Hoag Hospital has two main hospital campuses located in Newport Beach and Irvine. We have 14 urgent care centers, 9 health centers throughout the county. Hoag's medical staff includes more than 1,700 physicians representing 52 different specialties. Hoag includes 5 specialized institutes of excellence: neurosciences, cancer, heart and vascular, women's, and orthopedics. About Hoag. Hoag is designated as a magnet hospital as part of the American Nurses Credentialing Center's ANCC Magnet Recognition Program. And we're ranked as the highest ranked hospital in Orange County for 5 years in a row. Hoag in your community. Our Hoag Health Centers. Hoag is committed to providing healthcare services in the communities we serve through our Hoag Health Centers. We are located in Aliso Viejo, Costa Mesa, Foothill Ranch, Huntington Beach, Irvine and San Canyon, Irvine Woodbridge, Irvine Woodbury, Newport Beach, and Tustin Legacy. Hoag in your community, our Hoag Urgent Care. Hoag Urgent Care provides care 7 days a week for life's unexpected illnesses and injuries. We're located in Aliso Viejo, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine Los Olivos, Irvine Orchard Hills, Irvine San Canyon, Irvine Woodbridge, Irvine Woodbury, Newport Beach, Newport Coast, Tustin Legacy, Tustin Ranch, and we're excited to announce that we're going to be opening up in Dana Point in the summer of 2022. Also, we are located at the Hoag Flywheel Clinic, located at John Way Airport, Terminal B in the pre-security. Access to primary care. Primary care. You can access care with Hoag Hospital through Hoag Medical Group and Hoag Physician Partners. It's our IPA that we established in 2019. Hoag Medical Group. We have primary, urgent care, and specialty physicians. We have over 100 physicians, 21 primary care locations, 13 urgent care locations, and you can find more information at hoagmedicalgroup.com. Hoag Physician Partners. We have 10 primary care physicians, 350 plus specialists to serve our managed care patients. If you want to find more information, go to hoaghealth.org/HPP. Here's a little overview of Hoag Medical Group. Once again, we have over 100 physicians with specialties in family medicine, internal medicine, pediatrics, geriatrics, sports medicine, allergy and immunology, endocrinology and diabetes, rheumatology, HIV medicine, infectious disease, and palliative medicine. We are located in Aliso Viejo, Costa Mesa, Fountain Valley, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine, Laguna Beach, Newport Beach, San Clemente, and Tustin Legacy. Some of the features that we really pride ourselves on are same-day sick appointments for our established patients, and we accept most major HMO, PPO, and Medicare insurance plans. We also are proud that we provide unrushed, personalized visits. Hoag Physician Partners, or HPP, it's our Independent Physician Association, also known as an IPA. We have 10 primary care physicians, over 350 specialist physicians representing over 50 specialties. Our recent additions include Orange Coast Women's Medical Group, where we have over 20 OBGYN physicians at 6 locations, providing an integrated care model for women as they move through all the stages of their lives. We have Hoag Gynecologic Oncology, Hoag Urologic Oncology, access to the Hoag network, including Hoag Health Centers, Hoag Urgent Care. For customer service, call us at 1-800-369-9247. Right now, what we'd like to do is provide you with an overview of our health plan guests today, from Alignment, Scan Health Plan, Blue Shield of California. And right now, I'd like to introduce you to Fernando Galindo from Alignment Health.
Good morning. Thank you, Hogue, for having us here today. My name is Fernando Galindo with Alignment Health Plan. I am a territory sales manager. I cover the OC, LA, and Ventura markets. I've been in the industry for 20 years. I've been servicing my senior community. I am a bilingual rep as well. I also speak Spanish. A little history about Alignment Health Plan. We were founded in 2013 by John Cahill and leadership. We are a 4-star rated health plan. We are also a 5-star Part D prescription drug plan. And we were ranked 90% in the Medicare NU handbook. One of the unique things about our plan is we have the Alignment Concierge 24/7 department. They're available 24/7. And then we are also have 42 products in 4 counties. The plan that I'm going to be going over today will be the AVA PPO Plan 008 in Orange County. This is a preferred provider organization exclusive with Hogue Network. There is a $22 premium, no deductible on the plan. Your primary care visits will be a $5 copay, and your specialist visits will be $20 copay within network. Outside of network, for your primary care doctor's visits, will be a $40 copay, and then your specialist visits will be a $50 copay for out-of-network. Your maximum out-of-pocket within the network is $3,900. Your maximum out-of-pocket outside of the network is $9,500 combined. Does not include your prescription drug coverage. Your hospital copay, if admitted in the hospital within the network, will be $150 per day for day 1 through 3. Days 4 through 90 will be a zero copay, unlimited days. Out of network would be a 20% coinsurance. Your emergency room copay will be an $85 copay within network. And then your outside out of network would be the same. Ambulance copay is a $250 copay within the network. That's for air and ground. For out of network would be a 30% coinsurance. Your outpatient surgery copay is a $165 copay. Okay. And then your ambulatory surgical center will be a $100 copay for in-network. Outside of network for your hospital, outpatient surgery is 25%. Ambulatory surgical center is going to be 30% for out-of-network. Skilled nursing facilities, days 1 through 20 for in-network will be a zero copay. Day 21 through 51 will be a $100 copay. Out-of-network is a 30% coinsurance. X-rays will be a $15 copay within network, and laboratories would be a zero copay within network. Out-of-network is a 30% coinsurance. MRIs and CT scans will be a $150 copay within network. Outside of the network will be a 30% coinsurance. Diagnostic testing within network is a zero copay. Out-of-network is 30%. Physical therapy within network is a zero copay. Out-of-network is a 30% coinsurance. Urgent care copay within the network is a $20 copay. Out-of-network is a $20 copay as well, waived if admitted in the hospital. Prescription drug cost is going to be a tier 1, is a zero copay within network. I'm sorry, it's just within network or out network. So the prescription cost for your tier 1 is going to be a zero copay. Your tier 2 prescription is going to be a $5 copay. And your tier 3 is going to be a $40 copay. Your tier 4 is going to be a $100 copay. Tier 5 is going to be your 33% coinsurance. This is your specialty drugs. And then your tier 6 is going to be a $5 copay. Now, these are all for 30-day supplies, okay? If you had your tier 6 for a 90-day supplies, for a 3-month supplies, that would be a zero copay. All our pharmacies are preferred. We do not have a preferred or non-preferred pharmacy, so you can go to any pharmacy that's contracted with us, and that's really neat. You don't have to worry about going to look for a preferred pharmacy. All pharmacies are considered preferred pharmacies with us. Dental coverage, this is going to be included in the Options Plus package. There's a Option Plus package that has a $62 buy-up option for all our members. It includes the dental coverage. You have 90 days to enroll into this program if you wish to enroll. The dental coverage, if you decide to get the buy-up option, it's going to be the dental coverage, which is through Delta Dental PPO. You have a $1,500 coverage limit per year. Also includes hearing aids. You have your yearly hearing exam for free, but you get $2,000 allowance towards hearing aids every 2 years. You also get transportation available within the buy-up option plus, which is 12 one-way trips throughout the year. You also get your PERS, which is your personal emergency response monitor, and you get an extra $15,000 worldwide emergency coverage, which ends up being about $25,000 for worldwide emergency coverage. Embedded in the plan is the vision. We have a $150 allowance, I should say, for your eyeglasses. That's every 2 years, and that's through VSP. Your yearly eye exam is once a year for free. Health Club membership, that's included, and that is through Peer Fitness or Peer Fit Move. Also similar to the Silvers of the world, you have access to a lot of the big name gyms. You would just give us a call at our concierge service department, and we'll be able to set that up for you, let you know what gym membership you'd be able to go to. So for all my clients that are either considering MedSups, PPO is a great opportunity. It's a great plan for you to take a look at. PPO offers flexibility and freedom at a lower cost. So if you're paying $150 and plus Part D prescription coverage for your sub plans, take a look at this plan. This is really good. Your premium's only $22 a month. Your buy-up option, if you decide to get the additional coverage, is $62, totals out to $84. There's no underwriting, freedom to see the doctors out of network, no referrals to specialists. This could make sense to switch to a AVA PPO plan, which is a preferred provider organization exclusive with Hoag Network. I'd like to thank Hoag today for having me here today, an Alignment Health Plan. I will go ahead and take this back to Diana. Thank you and have a great day.
Good morning, folks, and thank you so much, Hoag, for having Blue Shield here today. My name is Diana No. I am an independent insurance representative, and today I will be going over Blue Shield of California. My contact information is in the chat box. However, for folks that are not viewing this live, my telephone number is 949-226-4064. A little bit about Blue Shield of California. We are a not-for-profit company based here in California. We've been in the healthcare industry or healthcare market for over 80 years. Blue Shield offers a variety of products, such as a Medicare Advantage plan, Medicare Supplement, as well as prescription drug plans. So what does that mean to you? We're a one-stop shop. We'll have a plan that will fit your budget and your needs. So Blue Shield offers a variety of Medicare Advantage plans, but for today's presentation, I will be going over the leading benefits for the Blue Shield Inspire for Orange County. On the screen here, you see a copy of the benefit highlights. It's just a quick snapshot. However, for today's presentation, I will be going over the comparison worksheet that you would find in the description box on the YouTube page or for this session. Okay, so that's what I'll be going over. So it'll be a little bit more in depth than what's on screen for you today. So as I mentioned, the plan that I'm going over is called Blue Shield Inspire. Is a 4-star plan. There's no additional premium for this plan besides what you pay for your Medicare Part B premium. Everyone pays for the Part B premium. To join this Inspire plan, it's a zero copay, zero premium, no additional premium. As for your primary care visits and your specialists, so anything from your cardiologist, endocrinologist, dermatologist, it's a zero copay. This plan has a maximum out-of-pocket of $799 for the year. What does this mean to you? This is the most you'll pay out-of-pocket for your medical expenses and hospitalization services. And once you meet that maximum out-of-pocket of $799, then you stop paying for your expenses. So I'll be going over a couple of copayments, and these copayments will apply to your hospital or medical services. So for example, if you land the hospital, you pay $0. If you have to go to the emergency room, it is an $85 copayment. This plan also includes worldwide coverage, meaning if you travel domestically or internationally, you are covered for emergency and urgent care services, and it's an $85 copay. Okay. As for ambulance copay, it's $100 per trip. So let's say you call the ambulance, you have a $100 copay. You land in the emergency room, it's an $85 copay. Those copays I just mentioned will go towards your maximum out-of-pocket. Okay. No one anticipates going to the emergency room or using the ambulance, but if you do, you have nominal copayments, and it'll just go towards your maximum out-of-pocket. As for your outpatient surgery services, so this is for your colonoscopy, cataract surgeries. If you have those procedures done at an ambulatory surgical center, it's a zero copay. But let's say your doctor tells you, you know what, you're a little bit high risk. We prefer you having this procedure done at a outpatient hospital facility, then it is a $150 copayment. So typically, hospitals have a higher share overhead cost, and so you'll be responsible for $150 versus the $0 at an ambulatory surgical center. Who determines this? Your doctor will determine which facility you go to. As for skilled nursing, so let's say you had a procedure done, maybe hip surgery. You're well enough to be discharged from the hospital, but not 100% well enough to go home. You may need extra rehab services. You may be discharged to skilled nursing. And for the first 20 days, so days 1 through 20, it is a zero copay. If you stay there a little longer, from days 21 to 100, it's a $50 copayment per day. So you may say, Diana, if I end up staying there 100 days, am I going to be responsible for a couple $1,000 since your copayment is $50 per day? The answer is yes and no. Once again, you do have a maximum out-of-pocket, so the most you pay out-of-pocket for medical expenses, such as skilled nursing, would be $799. So if you end up staying there 100 days, the most you pay out-of-pocket is $799 for the year. Moving along to the next few items, there's going to be a lot of zeros. You have your x-rays, your labs, your MRIs, CT, PET scans, diagnostic testing, physical therapy, speech therapy, occupational therapy, urgent care. It's all a zero copay. There's no cost associated with these services. Now moving on to prescription drug coverage, Blue Shield has an extremely strong formulary, so list of medications they covered. So the copayments I'm going to provide you today will be for a 30-day supply as well as a 90-day supply for the preferred pharmacies. Blue Shield contracts with over several thousand pharmacies, so the local ones you may hear of CVS, Costco, Walmart, Save-Ons, Albertsons, Ralph's, etc. Okay, so those are considered the preferred pharmacies. So if you have your medications filled at these pharmacies, for our Tier 1, these are your preferred generics. You'll pay a zero copayment for both a 30-day and 90-day supply. As for Tier 2, these are the generics. So it's either $3 or $4.50. For Tier 3, these are your brand name drugs. Typically your Eliquis, your inhalers, some insulin, they fall under Tier 3 as brand name. On Blue Shield, it will be a $35 copayment for 30 days and $87.50 for a 90-day. Tier 4 is the preferred non-preferred brand names. You're looking at $95 or $237.50. And lastly, Tier 5 is the specialty drugs. Typically, these are the injectables. It could be like chemotherapy pills, chemotherapy injectables that you pick up at the pharmacy. This will be a 33% coinsurance for those medications. This plan does not have a Tier 6, so you can disregard that. Moving on to the extras. So Blue Shield does offer dental coverage on this plan. It is a basic dental plan that covers cleanings, x-rays, exam. It is an HMO network, so you do have to use the provider that accepts that plan. However, if you're someone that prefers to have the flexibility and maybe see your own dentist that may not be in the HMO network, Blue Shield does offer a Ppo Dental Upgrade. As for hearing aids, this plan does include coverage. Depending on your level of hearing loss, there are two hearing aids covered on this plan. There is the Silver technology, which is $499 per ear, or the Gold technology for $699 per ear. And the hearing aid coverage is through a vendor called Epic Hearing. So they're contracted with multiple audiologists in the area, and you can receive your services through them. As for vision coverage, this plan also includes vision coverage different from your ophthalmologist. So there's optometry for your glasses, like your 20/20 vision, and there's ophthalmologist. This is for your cataract, your glaucoma. So the one I'm referring to is your optometrist. So these are for your glasses, contacts, and so forth. This plan, it's a zero copay for your exam, and it's administered through a company called VSP. And every 2 years, you will receive $200 allowance for your frames or contact lenses. As for your health club membership, this plan also includes that. It is through a company called Silver Sneakers. Many of you have heard of Silver Sneakers. They are contracted with multiple gyms in the area, like LA Fitness, 24 Hour Fitness, YMCA, some Curves locations for my gals. It comes to you at no cost as long as you're on this plan. And you can belong to all those gyms and go anywhere you want to go. That's in network for Silver Sneakers. As for transportation, this also included, you receive 32 one-way trips. So let's say you're not feeling well or you can't coordinate a ride to the doctor, the lab, the pharmacy even. This plan includes 32 one-way trips at no cost to you. This plan also includes over-the-counter. So you can order things like cough drops, ibuprofen, aspirin, cotton swabs. There's a catalog that you receive when you become a member of Blue Shield, and you receive a $100 allowance every quarter for these items. So $100 per quarter to spend, and these items are shipped to you directly at no cost. You can either order online, which is super easy peasy, or you can also call in and place the order when you're on this plan. This plan also includes a personal emergency response system. So several years ago, you may have heard the commercial, "Help, I've fallen and I can't get up." That's the device I'm referring to. So depending on your lifestyle, your activity level, you can either get the pendant, bracelet, or if you're a bit more mobile, a bit more active, you can also get the GPS mobile device at no cost. And it is through a company called LifeStation. For my folks that like to have alternative medicine services like acupuncture, chiropractic services, this plan also includes it at no cost to you. You receive 24 visits of each, so you get 24 acupuncture visits as well as 24 chiropractic visits at zero cost. You do have to use a network called American Specialty Health Network. Lastly, something new that Blue Shield added this year on their Inspire plan, home delivered meals. So after discharge from the hospital or maybe skilled nursing, you're probably not 100% well enough to meal prep at home. This service offers you 22 meals and 10 snacks per discharge to help you get you going as you recover. Alrighty? As I mentioned earlier, Blue Shield does offer Medicare supplement plans as well. Their rates are extremely competitive, especially for their Plan G Extra or their Plan G. So if you're interested in learning more about that, you're welcome to contact me. I do also want to note that Blue Shield has what we call an Underwriting Holiday. So my folks that are already on Medicare, maybe you're on a Medicare Advantage plan and have been thinking about maybe needing more flexibility, having options, Blue Shield is having what's called an Underwriter Holiday. So if you are interested in switching from a Medicare Advantage plan over to a Medicare Supplement plan with no questions asked, you're able to do so by the end of this month. So if you have questions about that, you're welcome to contact me, okay? Once again, my name is Diana No. My telephone number is 949-226-4064. You're welcome to contact me, and if you have any questions about your Medicare Advantage, your Medicare supplement, or prescription drug plans, welcome to contact me, okay? Thank you for your time. I am now going to introduce Scan Health Plan. She will be up next. Thank you.
Hi, good afternoon. I'm so glad you guys came to join us. Actually, good morning. I'm Joanne Boudet. I work for Scan Health Plan. I work directly for the company. I am a representative, a sales representative, and I also service my clients once they enroll with Scan. So you can also call me your member service representative as well. I've been in this business for over 25 years, and I know my Medicare pretty well inside and out. So if you have questions, you're brand new to Medicare, you're needing to sign up for Medicare, I can help you do that. If you have worked a little longer than past your 65th year and now you need some extra forms for Medicare, I have those for you. I have some inside phone numbers for you with the Social Security office as well. So I'm very happy to help you get enrolled. Scan has been in business for 45 years this year. We are a not-for-profit organization. We are 4.5-star rated plan, which is really phenomenal because we've had that for 5 consecutive years. We're very proud of that. Scan has multiple plans. We have plans that are designed for people that have diabetes, where their insulin is actually a zero copay, and that's phenomenal because that's pretty much unheard of. We also have plans designed for people with heart conditions. We have plans designed for people that are low income. And then we have plans designed for everybody else. And what we're going to talk about today is our Classic Plan. Classic Plan has been around for 45 years. It is our most popular plan. We have over 270,000 members, okay, with Scan Health Plan here. We are 4.5-star rated. I mentioned that. There is zero premium. So what we're going to do now is we're going to go over that sheet that you were provided. Premium is zero. Primary care doctor is also zero, and so is a specialist. You would have a maximum out of pocket of $499. That's a really important number for you because that means that's the maximum you would pay for any services that you receive under your Part A and B of Medicare. That would be for the calendar year, $499. Copay for the hospital is zero. Emergency room is $90, but the $90 is waived if you are admitted to the hospital due to the emergency. Ambulance copay is $100. Outpatient surgery, no charge. That could be cataract surgery. They're doing hernias and gallbladders outpatient. They even are doing some knee surgeries outpatient. And that outpatient surgery, zero copay, it doesn't matter if you have it done at the hospital or a surgical center. It's going to be a zero copay. Skilled nursing facility. This is what us baby boomers changed the name over to rehab. If doctor comes into the hospital and says you don't need to stay here any longer, but you're not ready to go home, we're going to send you over to rehab. It's going to cost you nothing. The benefit period under Medicare is 100 days. We're going to cover 100% of it. X-rays and labs, no charge. MRIs, CT scans, no charge. Diagnostic testing is a $50 copay. Physical therapy, occupational therapy, and even speech therapy are all zero copays. Urgent care, no charge. So it's important to know that urgently needed care and emergency care is considered it's going to be covered for you anywhere in the world. So we give you worldwide coverage for emergencies and urgencies. Even if you're on a cruise ship and you need to see that cruise ship doctor, it's going to be considered urgently needed care, and you're going to pay nothing. Okay. The next is going to be prescriptions. We have 3 ways you can get your medications. You can go to a preferred pharmacy. That preferred pharmacy would be CVS, Rite Aid, Vons, Albertsons, Costco. We also have a standard pharmacy, which would be Walgreens, Medicine Shop, and a few independent pharmacies. If you use a regular pharmacy or a standard pharmacy, you're going to pay a little bit higher. But if you go to a preferred pharmacy, our tiers 1 and 2 are going to be a zero copay. We also have a mail order service. It's called Express Scripts. Express Scripts is they'll send you a 3-month supply automatically. And with Scan, if your doctor writes the prescription for 100 days, you're going to get 100 days instead of just 90. So that's pretty important. So you can use the mail order service at the 3-month supply, but you can also ask for 3-month supply at any of our pharmacies as well. So CVS can give you a 3-month supply as well, and that would include the 100 days. Tier 1 and Tier 2 are your generic medications. As I mentioned before, there is zero copay if you're using a preferred pharmacy or the mail order. Tier 3 is going to be your brand name. These are ones that are been around for a little while, but they're brand name medications. It's a $30 copay. And then if you get a 3-month supply, you're going to save $20. So you would only pay $70 for that 3-month supply of a Tier 3. And Tier 4 is $95 for 3 months. $95 for 1 month and $265 for 3 months. These are the ones that we see advertised on TV. They're really expensive. And then the Tier 5 is your specialty drugs, which is a 33% copay. We don't have a Tier 6. Dental. We do cover you for dental through Delta Dental. It is an HMO dental plan. It doesn't require any premium. It's included automatically with our classic plan. You would get cleanings and x-rays at no charge, deep cleaning even at no charge. And if you needed something bigger like a root canal or heaven forbid, a crown and things like that that are a little more expensive, you would get all of the extra things like fillings and things like that between 30 and 60% discount. Because it is an HMO plan, there is no limit to how much coverage or how many teeth you get repaired or how much money that is spent, because you're just going to be paying the discounted prices. And also there's no waiting period. Hearing aids. We use a company called True Hearing. True Hearing is all over the United States. You can call them up directly, get your exam for no charge. And hearing aids usually retail around $2,000 to $4,000 a piece. Our cost on the classic plan is only $450 to $750, and that includes a 3-year warranty and all kinds of other little goodies like batteries and things. Vision is iMed. iMed is Sears, JCPenney's. Some of those are actually out of business. Let me go back. How about LensCrafters? You can go to America's Best, the commercial with the owl on it. That's where I got my glasses. You can go to a lot of independent optometry offices. We've got hundreds in Orange County that take iMed. You pay nothing for your exam, and then if you, on your glasses or contact lenses, you can apply a credit of $250. So we cover the first $250. If you go over that, you'll pay the difference. Health club membership, Silver Sneakers, very similar to what Diana was talking about. You can go do most of the gyms that are contracted through Silver Sneakers. But what's nice about Silver Sneakers is they also have some home programs. They have some walking programs. They've got videos. So there's a lot of ways you can get your exercising in through using the Silver Sneakers program. They are great. I really think they really do have us older folks in mind when it comes to getting healthy and staying active. Transportation, we give you 32 rides. That would be to the doctors, the x-rays, the lab, the pharmacy, even the dentist. So that's 32 rides with the transportation. Over the counter is, so our extras. Okay, so first thing we have is over the counter. Over the counter we're going to send you a catalog, and inside that catalog you're going to find all kinds of goodies, your vitamins, your minerals, your Band-Aids, your aspirin, ibuprofen. You can even find in there electric toothbrushes, blood pressure cuffs, all kinds of fun little goodies in there. We give you a $50 allowance to spend in that catalog every quarter. Okay, so if you see something in there that costs a little more than $50, you can wait till the second quarter, because every quarter your $50 that you don't spend rolls over. Any remaining balance or the full amount will roll over to the next quarter. So I was talking about an electric toothbrush. There's one in there for $80. You could buy it the second quarter, and then you'd still have money left over for vitamins, okay? So we want you to spend Scan's money, not yours. What we do after you make your order, you can do it online, you can do it over the phone, or you can do it mail order, and then we will mail you the items so you don't even have to go pick them up, okay? The next extra that we give you is a Fitbit. Fitbit is the little watch that you wear that counts your steps. You're probably familiar with it. It also keeps track of your heart rate. It keeps track of your sleep patterns. And so we have a little thing going on here. We want you to go to the gym with silver sneakers. We want you, if you don't want to go to the gym, you can go walking, because we're going to give every member a free Fitbit. Okay. With the Fitbit, you just call a member service, and then we mail it out to you. We don't send them to everybody. I mentioned that we have over 260,000 members, or 270,000 members with Scan Health Plan. Not everybody wants a Fitbit. Just so you know, we have over 350 of those members are over 100 years old. So that's pretty exciting with us. We actually celebrate them and have birthday parties. So the next thing with us is we have telehealth, where you can call a board-certified physician 24 hours a day, 7 days a week over the telephone. Give them a call, and what they'll ask you to do is maybe do a FaceTime with them, or you can do a Zoom call. And those doctors are reachable all the time, anywhere in the United States. So if you're on vacation or you're at home on the weekend and you wake up and you're not feeling well, and you know all you need is an antibiotic, because like with me, I get sinus infections, you can call a board-certified physician with Scan, not a nurse practitioner and not a nurse, but an actual doctor, and they can order a prescription for you and send it over to your neighborhood pharmacy. You send a family member over to pick it up, and you never got out of your pajamas, okay? So the other thing is Chiropractor Acupuncture. We also cover that through a group called ASH, American Specialty Health. Podiatry services. This would be routine nail clipping, callus removal. So you don't want to go to that nail salon just to get your toenails clipped and your calluses removed. Well, we don't give you the massage chair, but you can go to a podiatry office and get that done for no charge 6 times a year. Returning to home, one of my absolute favorites. This is the one where if you go to the hospital and you're coming home from the hospital and you are weak and you're tired, or maybe you have an incision, you go home and you try to do the things that you normally do at home, you're going to end up back in the hospital. So instead, you can call Scan, and we'll send somebody out to give you a helping hand. Help you take a bath, get dressed in the morning, help you do some laundry, change the linens on your bed, whatever you need. We're going to give you 40 hours. That's like 4-hour increments. If you did that every single day from coming home from the hospital, that's 10 straight days that you get extra help at home. In other words, you don't have to have a family member take time off of work to take care of you. You could actually have somebody come in from Scan and give you a helping hand. Included with that is food. We're going to give you 28 days worth of food, no charge. Fresh food, fresh fruit in that food packages. They put a great food plan together for you. That would come 28 days worth of food, 84 meals, no charge. And emergency response system. Emergency response system is the one where the woman says, "Help, I fell, I can't get up," and she pushes a little lanyard around her neck. We cover that for our members as well. It has a GPS system in it, so it's really nice. So if you're at the grocery store and you're having chest pains and you push that button, they're going to know you're at the grocery store. There's no charge for that. Normally, that feature is about $40 to $60 a month, and we're going to give that to our members that need it. Okay, we're going to give it to the members that would actually qualify because they have a chronic illness or they're very frail or living home alone. Okay, and one of the really neat ones is health tech. Health tech is for the members that are not real tech savvy. What we found after the pandemic is that, or during the pandemic, that a lot of our members didn't know how to use their smartphone, didn't realize that they had to see their doctors on Zoom calls. So we hired a company, we call them the Scan Health Tech 24 hours a day, 7 days a week. They'll help set you up with your My Chart. They'll help you with looking up your prescriptions. They'll help you walk through the systems and the smartphones and the computers and your laptops to teach you how to use the technology. We even let the technicians come out to the house if need be. Okay, so you can see that SCAN is not designed just for you and the doctor or you and in your insurance covering for your Medicare. We cover the whole person. What we're looking to do is to make sure that you're independent. You get to stay in your home and you get to live a really good active life. So that's what we're looking for. We look at the whole entire member. Like I said, we have over 350 of them, and they're over 100 years old. So we'd love to welcome you to SCAN. You can call me. Call me direct. I would be your representative, as well as helping you get enrolled in Medicare, and helping you stay and answer all your questions throughout the year. My phone number is 714-272-8983. Again, it's Joanne Boudet, 714-272-8983. I look forward to hearing from you. And next, we're going to hear from Jeanette. She's going to talk a little bit about the ins and outs of Medicare.
Good morning. This is Jeanette Paterka. I'm an independent agent, and I'm going to speak about Original Medicare. But first, I want to go ahead and let you know that the contact information for AARP Medicare Solutions is on the screen. Unfortunately, they were not able to be with us today, but you can contact Rosalie Puleo directly for information regarding United Healthcare. Thank you. Okay. So we're going to go ahead and get started with Original Medicare. This is a picture of your Medicare card. This card has changed a little bit in the last few years. If you take a look at the Medicare number, it's an alphanumeric number. That used to be an individual Social Security number, but now you have an individual alphanumeric number. You're going to need this card if you enroll into a Medicare health plan. It indicates your hospital Part A, which we're going to discuss, and your medical Part B effective dates. You need to have these two parts of Medicare effective to enroll into one of the Medicare Advantage plans we've been speaking about today. So what is Medicare? Medicare is health insurance for the following individuals. If you're 65 or older, or if you're under 65 and you have certain disabilities, if you're deemed disabled with Social Security, or if you have end-stage renal disease, which means you're on kidney dialysis, or Lou Gehrig's disease. As I mentioned, there's different parts of Medicare. Medicare Part A covers hospital, skilled nursing, facility, hospice care services. You want to think about that as when you go into a facility, those charges, the actual facility charges, are covered under Part A. And then Part B of Medicare covers the services that you receive. So your doctor's office visits, outpatient care, lab services, those are all covered under Part B. And then Part C of Medicare, that's Medicare Advantage. The plans we spoke about today earlier are all Medicare Advantage plans. Those companies have contracts with Medicare. They're private insurance companies, and they are, as I mentioned, contracted to provide benefits to individuals on Medicare. And then Part D of Medicare is the prescription drug coverage. The plans that we heard from today all have the prescription drug coverage included. So they're when I say MAPD, Medicare Advantage, PD is the prescription drug. So it's all baked in together. But if you have original Medicare and decide you want to enroll in a Medicare supplement plan, then you would purchase a separate Part D plan from the various companies that offer them. So there's different parts of Medicare and different ways that you can obtain your Medicare benefits. So Part A, most individuals who work and pay into the system, so basically you have that Medicare deduction out of your payroll check, you are actually paying into Medicare Part A. The guidelines are you need to work for 10 years or 40 quarters in order to receive Medicare Part A at no cost. Now, if you are a stay-at-home spouse and you have not worked that 10 years or 40 quarters, but you have a spouse that has, then you can go ahead and draw your Medicare Part A from your spouse's or your partner's working and paying into the system. And then Part B of Medicare, all Medicare beneficiaries must pay a Part B premium, and it's dependent upon your income. We're going to go ahead and we'll go through some information on that in a couple slides. But there is a premium for Medicare Part B, and this premium, if you're going to be opting into your Medicare health benefits, this premium is not an option. So it's it's deducted from your Social Security. Or if you are not yet drawing your Social Security award, Social Security will bill you on a quarterly basis to pay your Part B premium. And then Medicare Part C, those Medicare Advantage plans, as you heard today earlier, they can go from zero premium, and they, in certain areas or dependent upon the plan, can have premiums up towards $100 or more. So there may potentially be a Medicare Part C, Medicare Advantage premium. And then Part D of Medicare, as I mentioned, that's an individual Part D plan that covers prescription drugs, and those do have a premium. So the Part B income-based premiums for 2022, if you take a look at this grid, it's based on your adjusted gross income. So if you look at the second line there, $91,000 or less or $182,000 or less, that's for a single person or a married couple. And as I mentioned, it's adjusted gross income. And for those individuals that fall under that first bracket of pricing or income, you're going to pay $170 in 2022. $170.10 for your Part B premium, and that's each individual that is on Medicare will have to pay that premium. And as you see, if you go down that slide, if you're a higher income earner, in the bottom section there, greater than $500,000 for an individual or greater than $750,000 for a married couple, then each of you would need to pay $578.30. So it is a sliding scale, and it's based on, there's a look back 2 years on your tax returns where they determine what that amount will fall into, what bracket you fall into. And then there potentially could be also a Part D income-based premium. As you see on that top bracket, $91,000 or $182,000 or less, there is no additional premium. But if you do earn more, then you will also have to pay an additional premium for your Part D prescription drug coverage. Enrollment periods. So what we're talking about here is the enrollment period when you turn 65 and you are first eligible for Medicare. So when you turn 65, you have a 7-month window that surrounds that 65th birthday to enroll in Medicare. As you can see, it's a 3-month prior to your birth date, the month of your birth, and then 3 months after. This is the window if you decide you're going to go ahead and enroll into that, enroll in Medicare. Say July, your birthday was in July, your Medicare, and you turn 65, your Medicare can go into effect on July 1st. So you would want to go 3 months back, contact Social Security, let them know you want to activate or opt into your Medicare benefits. You will need to enroll in your Medicare Part B, and then you will be effective that 1st of July in your Medicare. And so as you see, there's a 7-month window. You want to make sure you contact Social Security within that window. Otherwise, there could potentially be some penalties involved. Okay, the next enrollment period is the annual election period. They call it the AEP. That's from October 15th to December 7th. This is the time when you're already on your Medicare plan, where you can change or enroll in a prescription drug plan, you can change your Medicare Advantage plan, you can return to original Medicare, or you can enroll in a Medicare Advantage plan if you're on original Medicare. So basically, it's the time leading up to this period where you take a look at your benefits and you determine if you want to make a change. And if you decide you do want to make a change, you would need to submit an application for your new company between October 15th and December 7th, and then that new coverage would be effective on January 1st of the following year. There's also an open enrollment period, the OEP, which we're currently in right now, and that falls between January 1st and March 31st. So if you're enrolled in a Medicare Advantage plan, you have a one-time opportunity to make a change during this period. You can switch to a different Medicare Advantage plan. You can drop your Medicare Advantage plan and return to original Medicare, or you can sign up for a Medicare Part D prescription drug plan. The way the effective days work is if you submit an application in February, as an example, your new benefits will be effective the 1st of March. So it's basically the 1st of the following month. And then we have the lock-in period. So that's from April 1st to December 31st. So whatever your plan you're on April 1st, you're going to be locked in and you need to remain on that plan for the remainder of the calendar year. And then, but if you do have, Medicare does have certain reasons, though, that if you need to make a change, you're able to do so. So those changes that are allowed due to specific circumstances. So if you're moving out of your current plan service area, Medicare Advantage plans are filed and based by county. So say if you live in San Diego County and you move to Orange County, you'll have an opportunity to enroll in the new plan that's based in Orange County. And if you can also enroll in a Medicare Special Needs Plan. And what that is, a special needs plan, as you heard a little bit about those today, some of the health insurance companies have plans that are specific to chronic conditions. So maybe if you have heart disease or diabetes, if you have one of these chronic conditions, you may have an opportunity throughout the year, to enroll into one of these specific plans. Or if you're a full dual beneficiary, what that means is you have both Medicare, which is the federal program, and Medi-Cal, which is the state program. Full dual beneficiaries may enroll throughout the year, and then also LIS, Low Income Subsidy. That's a state program that covers some of the costs, and we're going to go ahead and we'll talk about that in just a moment. Okay, prescription drug coverage. So much of the coverage that you heard today was actually much richer and better than what we're going to talk about right now. So what this is it's the baseline that Medicare requires Medicare Advantage plans to offer for prescription drugs. So in 2022, the initial coverage limit is $4,430. So the way that works is you first have a deductible, that's $480. So in January, maybe February, depending on how expensive your prescriptions are, you're going to go ahead and pay 100% of the cost of your prescriptions up to that $480. And then once you meet your deductible, between the $480 up to $4,430, you're going to pay a total annual drug cost that is combined, and it's paid by both you and your insurance company. So the way that works is in this example, if you have a $25 prescription, it's a total cost is $25. It's a generic. You have a $5 copayment, and your insurance company pays $20. $25 is going to be deducted from that $4,430. And so basically, you're going to tick down that amount throughout the year. And then once you hit the $44.30, you're going to go ahead and you're going to fall into a new phase or a new way that you pay for your medications called the coverage gap or the donut hole. In this phase, you have a temporary change, and between the $44.30, or once you hit that $44.30, you're going to pay 25% for your generics and 25% for your name brand prescriptions. And then once the total combined drug cost reaches $7,050, you are going to move into the catastrophic phase. And during this phase, you are going to pay $3.95 or 5% for your generics and $9.85 or 5% for all other medications. And you'll pay this until the end of the calendar year, and then all of the new numbers, the amounts will reset in January the following year. I mentioned low income subsidy. What this is, it's a program that is designed specifically to help cover prescription drug costs. This program is it's rolled out. You can go to the Social Security website, ssa.gov, and you can find the guidelines. It's a program if you are on a fixed income but maybe don't qualify for Medi-Cal, the state program, but you're on a fixed level of income. You may qualify to have assistance in paying your prescription drug costs. So I would invite you to go to ssa.gov. You can locate the low income subsidy or extra help area. And if you believe that, even if you think you're a little bit over the guidelines for what the income is, I would invite you to fill out the application. It's pretty simple. You get an answer back quickly. And if you qualify, it will help you pay for that medication. So for generics, you would pay $0 to $3.95. And name brand, you pay $0 to $9.85. This is a Medigap or a Medicare supplement comparison table. You heard Diana No with Blue Shield speak about Medicare supplement plans just briefly. These plans are designed to be they need to be purchased. There's a monthly premium, and they fill in the gaps that original Medicare does not cover. Original Medicare has deductibles and percentages of, they call them co-insurance, that you have to pay for particular services. So if you purchase one of these Medicare supplement plans, it helps cover the cost. As I mentioned, there is a monthly premium. It does go up. It can and does go up possibly on an annual basis, sometimes more than one time a year. So you have to pay that premium. And then what you can do is you can take a look at these plans and decide where you want them to fill in the gaps. So if you go all the way to the right-hand side, column N, what I want to call out actually for all of these columns is that all of these plans is that they're standardized. So if you're looking at a Blue Shield Plan N or a Mutual of Omaha Plan N, there's many companies, those benefit, the coverage on those will be identical. So a Plan N will be the same across every insurance carrier. So you want to take a look at the reputation of the company and then also the monthly premium. As I mentioned, different companies can charge different premiums for these plans. And then if you go all the way to the right, Plans C and F are only available if your Medicare eligibility date was prior to 2020. So Plan C and F were very, very popular, but from time to time, Medicare reorganizes or restructures their plans. So the way that this works is if you are, as an example, a working individual, and you are you've been working and you pay into your employer plan, have your company plan, and you're 67 years old, 68 years old. You're paying, you don't need to opt into Medicare because you have coverage through your employer. So the key to this is the fact that you were eligible, you could have opted into Medicare prior to 2020. So if you're one of those individuals that's still working and your Medicare potentially could have started prior to 2020, when it comes time to come off your employer group sponsor plan and enroll into Medicare, you are able to opt in or select a Plan C or F at that time. So with that, I want to thank you for your time, and I'm going to go ahead and turn the screen or the microphone over to Henry with Hogue, and he will give us some final parting words. Thank you.
health plan representatives for sharing information about their health plans. I want to thank Jeanette Paterka for giving us an overview of Medicare. More importantly, I want to thank all of you for taking the time this beautiful day, this beautiful morning to spend with us, and thank you for your patience. We just appreciate it. If you want any of the information that was provided, there was a lot of information provided today. Just look at our YouTube channel, and you'll see links at the bottom that you can click into and you can print. So having said that, just want to thank you. Have a great weekend. Enjoy this beautiful weather, and we'll see you soon. Thank you very much. Bye-bye.